Onc Live Insights is a video editorial program produced by Onc Live.
So there have been several studies looking at other TKIs that target KIT or PDGF, these agents haven't been compared head-to-head with the current standard therapies, but I think they're reasonable pathways to study, reasonable agents to consider on clinical trial. Those drugs aren't really approved currently for treatment of GIST, but there is phase 2 data to support potential activity in these settings. The pathways that are of interest for these patients remain KIT, PDGF receptor pathway, VEGF pathway has shown some activity, as well as the MAP kinase, MEK pathway. There have been studies, phase 1/2 studies, looking at pazopanib, which in patients who have failed imatinib and sunitinib demonstrated significant activity with a benefit in 4-month progression-free survival for those patients who were receiving pazopanib. So that combination, or that drug, actually is moving forward for further evaluation.
So with regard to emerging therapies in GIST, although we're all excited about the fact that there's at least 3 lines of therapy that are FDA approved for the treatment of metastatic GIST, and there's certainly a number of other tyrosine kinase receptor inhibitors that are being utilized in the treatment of GIST in an off-label fashion. There are a number of clinical trials that are occurring at this point, or that have been recently presented, that do demonstrate some level of efficacy that needs to be monitored closely, as it may eventually change how we treat this disease in the 4th line or beyond setting. There was a recent phase 2 trial that was presented at the annual meeting at ASCO 2015 in Chicago, in which patients were randomized to either receiving pazopanib or best supportive care. The primary endpoint was essentially progression-free survival. The plan of the study was to determine if they could increase the 4-month progression-free survival from 15% to essentially 45%. What was found on the trial was that patients that received pazopanib had a median progression-free survival of 4 months at a rate of about 46%, which essentially met the primary endpoint of the trial. Importantly, patients that only received best supportive care had a 4-month progression-free rate of approximately 17%. Furthermore, patients had a longer duration of stability with pazopanib, and the chance of tumor progression was almost double on the best supportive care arm compared to the pazopanib arm.